My name is Shawn Walker. I'm a Senior Research Fellow at King's College London. I'm an NIHR Advanced Fellowship holder, and I'm an Honorary Consultant Midwife at Chelsea and Westminster Hospitals. I became a midwife because I actually loved giving birth. Prior to becoming a midwife, I studied poetry, of all things. But when I was pregnant and giving birth, I felt that it was the most fascinating thing that ever happened to me. My first birth was complicated, but the experience of that complication made me really appreciate the work that midwives do, both to support women to do what they have to do on one of the most challenging days of their lives, but also to be the safety net. And you must have a high degree of skill. And I just was really attracted to that skill set and wanted to develop it myself. When I first started out as a midwife, I really wanted to provide continuity, which means you look after someone during pregnancy, in labor, and after the birth. And so very quickly, women started coming to me and saying they wanted help to birth their breech babies. And that was a key moment for me because I realized the demand existed. And to this day, at least once a week, including today, I get an email saying, I need help, I want to breech birth, and I need to find an experienced provider. So that very early experience of wanting to provide individualized care, meeting women's needs, made me realize that there was a huge unmet need that we needed to address. When I first started working as a breech specialist midwife, which was a role that I pioneered and created from scratch, I wanted to provide women with the best possible information for them to make informed decisions. I very quickly discovered that the research base didn't have everything that women needed or what I needed to give them good information. And so I realized there were a lot of research gaps that needed to be filled. And they actually needed to be filled by a midwife who was looking at things together in collaboration with women and our obstetric colleagues to look at it in that holistic way that midwives are very, very good at. I began to realize that in order to be the best specialist midwife that I could be, I also needed to be an academic. And that's why I started my PhD, to find out how professionals develop competence and confidence in vaginal breech birth in this part of the 21st century. This is my skill set. I have collected over more than a decade of working in this area. It involves learning clinical skills from people that have them, often my obstetric colleagues, because my clinical role is now an expanded midwifery skill set. So it's an advanced practice role where I'm using things like ultrasound and doing things that most midwives don't do, but specialist midwives do. And my academic skill set arose from following the questions that I had. So the NIHR Advanced Fellowship was the perfect clinical academic pathway for me. And that is because it enabled me to focus primarily on my research and developing my skills in my ability to deliver a clinical trial, which was what I needed to do that type of research. But it also gave me 40% clinical time. And importantly, it gave me ownership over that 40% clinical time. Midwives leading clinical research is still a fairly new thing. When you are a research leader, you need to be a change leader as well. And change is never easy. Oftentimes I try to talk about my research, for example, to an obstetric colleague, and they'll say, but who's leading the research? say, I'm leading the research. Okay, but who's leading the research? And you just have to be patient with that and understand that it's not because they don't want midwives to do research. It's just that the roles that midwives have played in research for so long have basically been data collection and consenting people to other people's, mostly medical leaders, clinical trials. So the idea that a midwife would design and lead a clinical trial across several sites in the UK isn't something that people are incredibly familiar with. So I often find myself repeating, over communicating, being very patient with the fact that people aren't trying to resist, they just aren't used to things being done in the way that we're trying to do them. But if we want midwives to lead research, and we do, then we need to be aware that we're part of a new process of change. When I teach people about breech birth, one of the expressions that we use is we want to look at each video, because we often look at videos where things have gone wrong in order to understand how to make them better. But I say we need to look at this video with compassionate understanding that that person was doing the best that they could do with the tools that they had at the moment. And it's such a privilege to be able to learn from that. And I think that on my good days, and not all of them are good days, we're all human, but on my good days, I try to respond to everything with compassionate understanding, that people feel that things are done for a reason, and they think that that reason is because it keeps us safe or keeps things in order. And it's scary to do things differently. So if I'm not patient with them, how can I expect them to be open to me when I'm asking them to do a major, major change? Find your niche and get settled in. And don't feel that you need to wait until you are the topmost expert to say anything of value. Share your journey. Start out with little professional articles about the area that you want to do research in. I think that you will have things of value to say all along as you're learning and growing. So don't be afraid to get stuck in and start being a part of the wider conversation in the area that you want to be leading in. Someone asks me a question and I can give them the most thorough answer they're going to get from anyone on the staff in my hospital, because that's my job. And if I didn't have time to do the research, to read the research, and to connect with other people doing their own research, I wouldn't be as good at my job as I am. And the fact that I am able to synthesize that research and put it into digestible chunks for other people who might not have academic careers means that their job is a little bit easier and they do it a little bit better. So clinical academics have an important role to play within any institution for disseminating the latest research and best practice. I hope, from a clinical point of view, that I will have made vaginal breech birth safer and more accessible for the women who would like to have that option. And I hope, from the academic side of my career, that I will have supported many, many midwives and doctors who want to do research in maternity services, to do their own research, and for some of them to go on to research careers.